The United Nations has called for, in the prevention and control of non-communicable disease and specifically smoking-related disease, it's called for a whole of society and whole of government approach in trying to reduce the disease and death linked to smoking. And in a way, that's exactly what the New Approaches Conference has managed this morning. Here we have a multi-stakeholder group in front of you, and you've heard outstanding pieces from Dr. Douglas from St. Kitts and Nevis, and then from Dr. Vobořil from the Czech Republic, from Czechia, and then from stakeholder leaders from across the world. So it's my privilege to moderate this session of about 20-30 minutes. We will first tease out some more answers out of our speakers, but then we'll have a question and answer session. The key question, Dr. Vobořil, is this. There are 212 countries within the United Nations, and not all of them embrace tobacco harm reduction. Your country, Czechia, and you memorably stated that you decided as government that this is not an intervention, this is part of policy. And the question is, how did you do that? When was the tipping point, and how did you manage to get the government as a whole to make this as a policy change?
Well, how do we do that? That's a difficult question. For decades, start with the falling of the Iron Curtain. I don't want to go into long history, but we had a strict totalitarian Stalinist regime until 1989. And when the fall of the Iron Curtain came, people were fed up with thinking that government says it will work and it doesn't work. Yeah, so we are very careful and very skeptical about the claims like world free of drugs, world free of smoking. We can do it. Yes. Since the end of 80s, the drug policy was led by professionals, by medical doctors, by people who worked in the addiction field. In the 90s, the main point was the emergent situation after the fall of the Iron Curtain with heroin and methamphetamine production and country flooded with new drugs. So harm reduction was the solution because we were a country with almost broken economy because of the decades of this social experiment of government ownership of everything. So we didn't have money. So we said, okay, what do we do rationally? We need to reduce harms and risks in drugs. And then, when I came to the to the position of National Coordinator, 2010, I saw that a lot of services and policies around smoking, around alcohol and gambling were not existent. So we said, why don't we look at it as one area, because it's one type of behavior and we have different kind of products which pose different risks. So I put forward the idea of integrating policies and put all the data. I think one very important thing is that under my office as a national coordinator, I had a monitoring center. So I had all the data all the time. So we have decades of reports on tobacco, and alcohol, gambling, and illicit drugs. So when I come forward to the government with data, it's very difficult to the government to say, oh no, we're not going to listen to it. So combining data with practical politics is important, I think. But at the same time, I think it's to do something with our skepticism about these big ideas that the world will be all just and we will all be in paradise. And when we say, okay, there's not going to be addictions, it will disappear. No, it doesn't happen. That's not realistic. So given this pragmatic situation, we said, okay, let's look at options. So we have the budget because I mean, another area is the economics of the whole thing. So we know how much it costs. We know how much the whole situation around 15, 16,000 people dying, but also being ill before that. So we spend so much money on the health insurance because we have the very strong health insurance policy. So everybody has an access. But people who smoke are more ill than other people. So all these economics play a big role in the whole thing. So I'm not sure if I'm answering properly.
Yeah. If I could ask you to please sit here as our
okay.
honorable government official. One more question to you, Dr. Vobořil, and that is, during your talk you spoke about your work as a psychoanalyst, where you work with individual patients. And often this debate does not take into account the tension that there is between individual health and population health. Suheli in her speech spoke about every smoker has a name. A person who smokes has a name. How is your work as a person looking after the individual health of patients and of people who smoke factored in and influenced your view on tobacco harm reduction?
Yes, I think this is the important issue that the National Drug Coordinators, as it's called, in Czech Republic since 80s were professionals from clinical practice. So people have more trust than when just politicians come with ideas, or I don't know, tobacco companies come with numbers. And for us, people coming from the clinical practice, it's personal. You are right. Yes, for me, it's not numbers. I see concrete people. I saw people dying. I worked in dying situation with elderly people. I worked with addictions, so I saw people dying with my own eyes. So it's personal, of course. So I have very strong support by media. I think it's quite important. Last year I had 5,000 media releases, media releases, only positive or neutral, because I come with numbers. Even though I'm a government official, I have strong trust because I come from practice and I speak for not only with data but also with experience and with personal view on it.